Welcome. I am Dr. Christopher, an otorhinolaryngology head and neck surgeon at Gleneagles Hospital, Penang. This video focuses on understanding head and neck cancers and identifying when ENT symptoms become serious. We will provide a comprehensive guide to head and neck cancer screening protocols, emphasizing that early detection saves lives. You'll gain essential insights from an otorhinolaryngology specialist perspective. Head and neck cancers are subdivided by where they originate. These include tumors of the nasal cavity and paranasal sinus, nasopharyngeal carcinoma, oral cavity cancer, and cancers of the oropharynx, hypopharynx, larynx, and salivary gland. Cancer cells spread through three main pathways: direct extension, lymphatic spread to regional lymph nodes, and hematogenous through the blood vessels. Lymphatic spread is particularly common and critical for staging head and neck cancer. Screening is vital because early detection leads to better survival rates and less invasive treatments. Since many of these cancers are, quote, silent and don't cause pain initially, regular screening is the key to detection at the most treatable stage. Major risk factors include tobacco use in all forms, heavy, long-term alcohol use, and HPV, which is a growing cause of throat cancers. Occupational exposure to wood dust or chemicals is also a risk. Reducing these factors is essential for prevention. These are the red flags to watch for. If any of these symptoms last longer than 2 weeks, consult an ENT specialist. They include nose and ear bleeding, non-healing mouth ulcers, a persistent neck lump, difficulty swallowing, voice changes, or a persistent cough. Other critical symptoms or red flags include chronic hoarseness, a persistent sore throat that doesn't resolve, unexplained ear pain referred from the throat, and red or white patches in the mouth lining. Screening is recommended for high-risk individuals, such as current or former smokers and heavy drinkers. The age factor is generally adults over 40, but we're seeing more HPV-related cases in younger people. Finally, anyone experiencing the, quote, red flags should be screened. Step 1 of the screening process is taking the clinical history. Your doctor will ask about your smoking and drinking habits, family history, and document exactly how long you've noticed any symptoms. Step 2 is the physical exam. The doctor will look inside your mouth using a bright light and mirror. They will also use gloved fingers to palpate the floor of the mouth, tongue, and cheeks. Step 3 involves neck palpation. The doctor will feel your neck for enlarged lymph nodes or masses. Cancerous lumps are often firm, painless, and fixed in place. The doctor is looking for key observations during the exam, such as leukoplakia, white patches, erythroplakia, red patches, ulcerations, any unusual growth, and asymmetry between the sides of the mouth. Step 4 of the screening involves an endoscopy. Rigid nasal endoscopy helps identify sinonasal and nasopharyngeal tumors. Flexible nasopharyngeal laryngoscopy examines pharyngeal and laryngeal tumors. If an abnormality is found, a screening is not a diagnosis. A biopsy is necessary, where a small tissue sample is taken to check for cancer cells. This procedure may be done in the office or under light sedation. If a lump is found, the ENT may order further imaging tests to guide diagnosis. An ultrasound helps determine if neck lumps are solid or fluid-filled. CT or MRI scans assess the precise size of a growth and check for spread. A PET scan looks for cellular activity throughout the entire body. Prevention is better than cure. The most effective ways to protect your long-term health include quitting tobacco, moderating alcohol consumption, and getting the HPV vaccination, which prevents many throat cancers. You should also use lip balm with SPF for sun protection. Let's address some common myths. Myth 1. If it doesn't hurt, it's not cancer. Fact. Early head and neck cancers are often completely painless. Myth 2. Only old people get this. Fact. While more common in older adults, HPV-related throat cancer is rising in younger populations. Here is a summary checklist for early detection. Perform a mouth check monthly in the mirror. For voice health, don't ignore hoarseness for more than 3 weeks. Palpate your neck regularly for swellings. If you have painless nosebleeds or persistent neck lumps, see an ENT specialist. In Malaysia, nasopharyngeal carcinoma is historically the most common, ranking as the 5th most common cancer overall. Thyroid cancer is frequent among females. Larynx cancer is associated with high rates of smoking. Oral cavity cancer is prevalent in certain indigenous populations. Head and neck cancers are complex, but recognizing the risks and symptoms is key to improving outcomes. Early detection and proactive screening through your ENT doctor can make a significant difference in your journey.